This information is for educational purposes only and is not medical advice. Please consult your provider before making any changes to your care.
Welcome to the Lichen Sclerosus Support Network's channel. I am Kathy, your host and executive director of LSSN. I also have lichen sclerosis. I have had it, it's going on 10 years now. And I'm so excited to be here with you today because we're going to be talking about our Lichen Sclerosus Support Network Mini Summit, which this is our first year doing it. We're talking about vulvovaginal conditions. And I know for a lot of us, it's like, dude, I already have LS. I don't need to be thinking about anything else down there. But here's the deal. You do. And we're going to talk about why, because it is so important. And if you're not thinking about other stuff that's going on down there, you run the major risk. And so I'm going to go through 5 different reasons that you want to be at this summit, and stay to the end because I'm giving you guys a bonus, and you're not going to want to miss it at all, especially if you have lichen sclerosis. If you don't know me, I am the host of Lichen Sclerosus podcast and executive director for the Lichen Sclerosus Support Network, which is a nonprofit looking to empower people with LS through evidence-based information and support. And we're doing that on both sides, not just the patient side. We are doing that on the provider side as well, because we completely understand that it's not an issue of awareness on the patient side. It's an issue of awareness on the provider side as well. So let me tell you about the Lichen Sclerosus Support Network Mini Summit on Vulvovaginal Conditions. Okay, this summit is a weekend summit. It's 3 days, Friday, Saturday, and Sunday. And we did that on purpose because we have our big summit, which is a week long in May. And we hear from the community, I have to work, I can't make it. So we made a mini summit on the weekend just for you. And it's 3-day virtual summit. That means you don't even have to leave your home, okay? We're going to be going from Friday, Saturday, and Sunday between 9 a.m. and 6 p.m. Eastern Daylight Time. Our speakers are going to be presenting in 1-hour blocks. And for our main sessions, they're going to be 45 minutes of presentation, about 15 minutes of Q&A. And then we have our all access sessions, which are exclusive to our all access pass holders. So that's our higher tier. Both passes include replays. And so we're going to be talking about vulvovaginal conditions that are rarely discussed. I know for me, the first time I heard lichen sclerosus, it was the day I was diagnosed. The problem with that is, how long did we suffer before we heard those words, right? How long did we go along with symptoms like itching, burning, pain with sex, anatomy changes? How long were we suffering before someone said those words to us and was able to give us a diagnosis? I know for me, it took 5 years, and that was 5 years too many, multiple doctors. And had I known what I know now, I could have went into the provider and just said, listen, these are my symptoms. This is what I have, and I need help. And so this is why we decided this is a very, very important series. And this is not just going to be these 7 conditions. We're going to be doing multiple series of conditions because it's important that we know what can happen to our body so that when we have those symptoms, we can go to our providers and say, listen, I know about this condition. I need you to give me whatever test so that we can get a diagnosis or we can rule it out, because I know my body. I know what can happen to my body, and I need you to be here with me. And if you have a provider, we always preach about team, right? We don't want a provider who's a dictator. We want a provider who is going to be part of your team and work with you to get diagnosis, to get treatment that fits within your lifestyle. This year, we're going to be talking about 7 conditions that are rarely talked about. We're going to be talking about lichen sclerosus. Our favorite medical board member, Dr. Jill Kraft, who's one of the leading LS researchers and vulvovaginal specialists, is going to be teaching us about lichen sclerosus. We're going to be learning about overactive pelvic floor muscles, lichen simplex chronicus, which, believe it or not, LSC is diagnosed as LS and vice versa a lot. But here's the kicker. LSC is curable. So imagine you get diagnosed with lichen sclerosus, but you have LSC, and here you're thinking, you got to live with this condition for the rest of your life, and you have a curable condition. That's going to mess with your mind, right? So it's super important that we understand the differences in these conditions. We're also going to be talking about genitourinary syndrome of menopause. Okay. That's the heat flashes. That's all of those things that go along with menopause. Guess what? You don't have to live with them. There are things that can be done, but they have to be diagnosed properly. Your provider can't just say, oh, you have menopause. It's part of life. Be on your way. No, there are things that you can do. There are lifestyle changes that you can do. There's different things that you have control of, but there's also medications that can help you. And there's such a fear around like estrogen and things like that we need to be able to advocate for ourselves. And I'm not talking about just on the patient side. I'm talking about on the provider side too, because there's a lot of times that providers are not prescribing topical estrogen for GSM because they're not up on the current research. We're going to be talking about persistent pelvic nerve pain. So there's so many times that we have gotten people in our virtual meetups. If you don't know, we do virtual meetups every other Saturday from 2 to 4 and 7 to 9 p.m. Eastern Daylight Time. Join us. It is a very supportive group. We are there for you. All the feels, good, bad, pretty, and the ugly. We celebrate and we hold your hand and give you big virtual hugs. We're here for it. But the thing is, we've had so many people come in and say, listen, I'm doing the treatment. My skin looks good, but I'm still in pain. What's going on? And they don't know there is such a condition as persistent pelvic nerve pain. And that can be treatable. There's so many different ways. That's multi-level treatments. That can be working with a pelvic floor physical therapist. That can be Botox injections. That can be nerve blockers. It's a condition that has to be diagnosed first and then can be treated, it's multi-layered. But if you have your LS and you're thinking it's just part of your LS, you don't know to go to your provider and talk to them about this. And we're going to be talking about, I'm going to butcher this one too. It's HS, it's hidradenitis suppurativa. I think that was close enough. This is another condition that many people with LS also have and don't even know about it because it is rare. But we have to know about it, especially in this lichen sclerosus community. So I'm going to start talking about the 5 reasons you need to attend the LSSN Mini Summit. Number 1 is misdiagnosis. And I have a lady she was an LS warrior. LS Warriors is the LSSN membership, our private membership. We have meetups. It's just a private family where you can talk about your LS, ask questions, celebrate wins. But anyway, we had a warrior who was part of the group, and she wasn't diagnosed yet. They told her it was probably LS, but the treatment wasn't working for her. And after months of being with us, months of asking questions, months of getting information, she was able to get a diagnosis, and it wasn't LS. It was lichen simplex chronicus, which is curable. So we were all happy for her. And she just reached out to me the other day. She's going to be at the summit, and she is doing so much better. But if she had continued treating like it was LS, she could have overtreated, because remember, LSC is curable. And so she could have been overtreating with the steroid and made her condition worse. That's why it's super important that we know what we're treating and we treat it properly. And so that brings us to our second point, secondary conditions. It is very, very possible for you to have more than one condition to your vulva. There's actually a study going around looking at people who have both HS and LS. There's also a lot of people who have lichen planus and lichen sclerosus. So for example, I had this one lady, she was so sweet. She had been suffering for about, I believe it was like 5 years. She had been diagnosed 8 years ago. She said her treatment was working For the first 3 years, she was able to get into remission. She was pain-free. She had no symptoms. And then all of a sudden, she started having like these lesions that started weeping. And, she just thought, oh, it's my LS, right? Because she didn't have information on the symptoms, the possibilities that come with LS. I mean, we weren't here 8 years ago. So she just thought, this must be a manifestation of my LS, right? What did she do? She did what we're supposed to do, right? Increase our steroid treatment and start our schedule all over again. And so she did that, but she wasn't getting better. And so her lesions started weeping. And now she's in a panic. She doesn't know what to do. And so she's going from doctor to doctor, and they're not helping her. So she emails us, and I was able to point her to our provider directory, which, if you don't know, we do have a referral-based provider directory. The only way that providers can get onto this list is by one of their patients referring them to us. Just this morning, I had a pelvic floor physical therapist that was trying to get on the list, and I'm like, hey, I'm sorry. Give them our information and have them refer you, but I can't put you on the list. Great credentials, but I couldn't put her on the list. That provider directory is at lssupportnetwork.org/providers. She was able to go see one of the providers on our list, and she was able to get a diagnosis, a proper diagnosis, because she had been misdiagnosed, where she was treating it as LS, but it wasn't LS. It was actually HS. Again, this is super important because so many times we're just thinking, oh, I have lichen sclerosus, so I'm going to treat my lichen sclerosus. Everything down there is not lichen sclerosus. One of the things, and this is not something that we're going to talk about at the summit, but this is so important, yeast infections. 75% of people with vulvas will have a yeast infection at some point in their life. When you are using topical medications like the topical steroids, topical calcineurin inhibitors, which we use for our condition, you are at increased risk of having a vulvar yeast infection, which a lot of providers aren't looking at. They're going straight into the vagina. And so it's super important that we advocate, that we know this for ourselves, that we advocate for ourselves and say, we go in there and we let them know, hey, I'm having this redness, I'm having this itching, I'm having this rash, I'm having this burning on my vulva. I need you to swab my vulva, not my vagina, for yeast. Because if they swab the vagina, they're not going to find it and you're going to get misdiagnosed. And so it's super important. And I'm going to tell a personal story. When this was earlier in the year, I want to say about January, February sometime, I started getting some itching around my anus. And for those who don't know, lichen sclerosus can affect your vulva as well as your anus. And I was like, am I developing LS around my anus? It's possible, because I knew it could happen, but I didn't know. And I didn't want to apply some steroid down there without knowing for sure. So I went to the dermatologist. She looked, she couldn't tell. So she sent me to a gynecologist. And the whole time I'm thinking, okay, I have LS in the anus now. This is something that I'm just going to have to learn to deal with and go from there. So the gynecologist, she looked, they thought they were going to do a biopsy on me. When she went and looked, she actually did a swab, and it came out to be BV, bacterial vaginosis, which is another common vaginal condition, but I had it on my anus. And I didn't have the typical symptoms like the fishy smell and things like that because I had it on my anus. But the thing is, I didn't know, right? I could have been treating myself for lichen sclerosus, and here it is BV. And so what did they do? They treated it for 5 days. I treated it with like a cream, and then I'm fine. No more itching around my anus. And it could have gone left, because had I been putting steroid around my anus when I didn't have it, I could cause myself more damage. And so it's very important that we know what conditions we have, because not all conditions are going to be treated with steroids. As a matter of fact, some conditions can be made worse with steroids. Let's go back to yeast. You put steroids on yeast and you're going to make it worse. Your yeast infection is going to get worse. So again, it is super important that we know these different symptoms and what those possibilities are. And throughout the summit, we're going to be telling you what the symptoms are, what to look for, who to go to when you have these symptoms, what you can do for yourself for symptom relief. Why? Are there things that we can do to help prevent some of these conditions? Number 3 reason, proper treatment. We just talked about this. It is so important that we just don't throw our treatment on our vulva when we feel just, anything, because we could be creating a worse situation for ourselves. We already talked about yeast. We talk about Lichen simplex chronicus. All of these things can be made worse with steroids. And then if we're not treating our secondary condition properly, it could be progressive. It could be getting itself worse. Okay. So it is super, super important that we have our proper treatment. We're going to talk about all of that. And one of the beautiful things about this summit and about LSSN, this is something that makes us special. I don't know any other summit or conference or whatever you want to call it that gives you the replays that are keyword searchable. Okay. This makes it so that you have a medical resource at your fingertips. All of the replays, the software automatically creates a transcript, and you can keyword research that transcript. So if you have a symptom, you can go into that playlist, type in your symptom, and it's going to pop up all of the different sessions where they talked about that symptom. How amazing is that? That's going to be better than Google, because these are experts in their field that are educating you. And then if you have the all access pass, which I totally recommend, you will be able to have think about it like a consultation with these providers. You'll be able to talk to 7 different providers, ask them questions without having to leave your home. Do you know how much 7 telehealth visits cost? Plus, you're going to have the replays of those at your fingertips so that you can go back and review that information, and all you have to do is keyword type. It pays for itself. That's just a part of the package. The other part of the package is you're going to get a PDF downloadable that is going to have these conditions, what they are, what their symptoms are, although you're going to have a breakdown of each of the conditions that you can go and quickly just go to the page, read up on it. If you feel like, okay, I need some more information on that, then you can go to the replay and keyword search to the part where you want to get the information from. I don't know of any other summit or conference that does that. Stay with me, because I'm giving you guys a bonus at the end, okay? And the 5th reason you want to come to the summit is so that you are empowered and you can advocate for yourself. It is so important that we go in armed with information, and we are not just relying on these providers to give us their knowledge, right? I was just reading an article. This researcher said 10% of people who go in to the doctor's office have vaginal pain. 16% have chronic vulvar pain. And providers are given very, very, very little vulvar education. It's literally, they are taught all about the vagina. Their focus is on making sure that you can give birth, everything is centered around your reproductive organ. The vulva is an afterthought. But the thing is, the vulva holds a lot of power, because if the vulva is sick, guess what? You're not going to be wanting to use your vagina, right? If the vulva is not feeling well, you're not trying to have anybody go through to get to the vagina. So it is very, very important that we know the words, the proper language, the proper symptomology, that when we walk into that office, we say, this is what I'm feeling. I've done my research. I've spoken to experts. It's not a lie. If you come to the summit, you're going to speak to experts in their field. I've spoken to experts. This is what they are saying. I need you to do this test or I need you to look at me so that you can diagnose or tell me that this is not what it is. And we can go further. But you got to have that knowledge to have that power to be able to walk in there. You become the expert and they become your teammate. They are also the expert, but then you become their teammate and not that you're there for them to just talk to you and tell you this is what it is. And we don't want to go in there and be talked about, don't go to Dr. Google. We don't want to hear that. So many people have emailed us and say, I went to my doctor and I was told, I know what I'm talking about. Stay off of Google. Don't even get me on that soapbox. So those are the 5 reasons that you should be at the LSSN Mini Summit for Vulvovaginal Conditions. Misdiagnosis, secondary conditions, proper treatment, empowerment and self-advocacy, and having a medical resource that you can trust at your fingertips. We have 2 passes. We have our basic pass, which is $25, and that's going to continue to be $25. And with the basic pass, you get the live access to the main sessions, and you get the replays for 30 days. Now, those are keyword searchable as well. With our all access pass, we pulled out all the stops. Literally is our all access pass. You're going to get access to all of the sessions. So you're going to get exclusive Q&A sessions with the doctors. Remember, we talked about those consultations, those telehealth visits. They're going to run you anywhere from $150 up to $300 or more with some of these experts. You're going to get all of them for $99. Okay. You're also going to get the replay of all of those sessions, including those Q&As, and they're going to be keyword searchable for life. So here's that medical resource that we were talking about. Then you're also going to get a beautiful PDF guide that you're going to be able to download, or you can access it online whenever you're ready. And you'll be able to go and they'll have notes and worksheets from the providers with quick notes letting you know, okay, about this condition. So you can quickly go and look. And then if you want to go further, you can go into the videos. You're also going to get a commemorative mug. So I want to show you, these mugs are so cute, y'all. People already have started receiving their mug. So there's one. How cute. That's our little logo. Here's another one, because we're talking about it, right? So many times, actually, we shouldn't talk about that. Yes, we should. We got to talk about this. No more stigma, no more shame. We're talking about it. And there's our third mug. So you get your choice of one of these 3 mugs. Okay. Bonus time. Not only are you going to get all of those, but you are going to get all of the replays from the 2022 and the 2023 Holistic Healing Summit. Now, if you don't know what the Holistic Healing Summit is, let me tell you. That is our week-long summit where we talk about managing and living with lichen sclerosis from a whole body approach. It is evidence-based information. It is coming to you from experts in their field. We are talking about not just treatment. We're talking about lifestyle. We're talking about diet. We're talking about sexual health. We're talking about wellness, mental health, all of these things. We have sessions on dilators. We have sessions with nutrition therapists. We have sessions with psychologists, vulvovaginal specialists. There are 48 different videos in this playlist. That is almost 2 days worth of videos that you're going to get for free with the all access pass. Okay. And you're going to get access to them till November 1st. This freebie is only going to be until September 18th is the last day. So it's only going to be for 1 week. The 19th, it goes away. So if you get your pass today, you're going to get them for like 45 days. So you want to get your pass early so that you can start looking through these videos now and help on your LS journey. These videos are valued at $200. We sell them on our shop. Each one of the tickets to these summits was $100. So if you get your pass today, you're going to get over $300 worth of value for $99. I don't know about you, but I was an extreme couponer, and that's a really good deal. Okay, you do not want to miss out on this. $99 for all of that. You get automatic, immediate access to those replays so that you can start looking at them today. Dr. Jill Craft, she's teaching on these. Dr. Corey Babb has done a Q&A on these. We have Dr. Heather Jeffcoat, who wrote the book on pain without sex. She did a session on dilators. You know, if you're want to know what's going on with the research, we have a session on that. We've covered so much sexual health. We have pelvic health. We talk about bathroom issues, all of these things. Get your pass today. You have automatic access to that and so much more. We have sessions on diet. We have so much. I could go on and on and on. You get access to all of those videos till November 1st. You get access to the summit videos for life. Okay. You get the PDF. Which you'll have access for life. You have your commemorative mug, which you'll be able to drink your coffee or your tea out of every day for life. We have a brain retraining videos on there. There's so many. I can't even name them all. You will be able to access today. So go to lssupportnetwork.org/Mini Summit 2023. Get your ticket today, your all access ticket. I'm going to show you what you go to. When you go to lssupportnetwork.org/Mini Summit 2023, you're going to see the screen and you're going to go where it says buy tickets, choose your all access pass tickets. And then you're going to go through the process, and then you're going to get an email from us. And in that email, it's going to tell you where you need to register, because after you get your ticket, you have to register your account to create your password. Then if you're going to come to the summit using your mobile device, we have an app. Our platform has an app to make it easier, to make it a better user experience. Then you're going to pick out your mug. You can fill out your form so you can pick out which design and where you want that mug shipped. And then you're going to have the links to your playlist with all 48 videos. So you can start keyword searching and going through the videos and watching them right now. Go ahead, right now. With the basic pass, you get only the main session recording. So that's 7 sessions for 30 days. With the all access pass, you get the main sessions and the Q&A sessions, which is a total of 13 recordings for life. I hope you grab that bonus right now. Get your tickets, get 48 extra videos all about living with lichen sclerosus for free right now. You're getting over $300 worth of value. And even if you don't come live, you have all of the recordings to be able to go back to, and you have the PDF to go back to for life. lssupportnetwork.org/Mini Summit 2023. Get your pass. And this freebie is only going to be until September 18th is the last day. So it's only going to be for 1 week. The 19th, it goes away. So if you want the access to the Holistic Healing Summit videos 2022 and 2023, you want to get them before the 18th, because then they're going to go away. Thank you so much for joining me. Sorry about my voice, but thank you. I'll talk to you later. Bye.